Good evening, time check. 11:41 na ng gabi at ayun na nga, after a 3-day Christmas break, balik na naman tayo sa ating online clerkship. Rotation namin currently is pediatrics. Mangyayari bukas ay isang star session. So yung star session, search, think, act, at react. So sa search, 7 o'clock mag-start yung session namin bukas. Yung sa search, na isang group yung assigned, so hindi kami yun. Maghi-history and PE sila. So kami, after 2 hours nun, kami yung think, which is iisip kami ng approach diagnosis, yung mga differential diagnosis, laboratory workup, tsaka discussion. So dun kami assigned bukas. So after 2 hours ulit, yun na yung act, which is yung mga pharmacological at non-pharmacological management, tsaka yung mga admitting order, prescription writing. Tapos after 2 hours nun, last na yung react, then i-discuss yung mga progress notes, tsaka yung mga journal, ganyan. Tapos yun, tapos na yung session for the day. From 7 to 5 ata kami bukas. So gagawin natin ngayon is magpre-prepare lang. Kakain na ako ngayon. Ang aga-aga nun, di ba? Ayan. Luto tayo ng ramyun. Kuha tayo ng fish cake dito sa freezer. Tara, tara. Yung pedia for me, Crammer's Paradise yan. Kasi 2 hours lang kami mag-prepare after nung disclosure ng first group. So, within the day lang mismo yung gagawa. Ayun, chill lang tayo tonight. Chill lang. So ayun na nga, mag-go-1 na 12:54 na. Ligo lang ako, tapos balik ako in a bit. Hi! I'm back! Ayun, nakaligo na ako. Ito usually yung ginagawa ko, naliligo muna ako sa gabi, tapos sinusuot ko na din yung uniform namin, which is scrubs naman, so comfy siyang pantulog. Pinapantulog ko na din to, tapos paggising sa umaga, kahit late na magising, ganun, at least, kahit walang hila-hilamos, diretso na sa online class, pwede nang umattend. Good night, guys! See you later! Bye! Yun, 6:57 na. Yan, online na tayo. So kami na mga TARR makikinig lang sa kanila para malaman natin kung ano yung case ngayon. Ayun, nakapasok na tayo. Hinihintay na lang natin si Doc kung anong oras siya darating. Medyo late.
Good morning po, Doctor. Start sa group design for the history.
So yung case natin ngayon is asthma in exacerbation based sa history niya. So ngayon, kaming mga think group, mag-search na ng mga iisip ng mga differentials, ganun. Tapos yung approach diagnosis, yung laboratories, tsaka yung discussion ng asthma niya. Ayun. So habang nag-session, dapat naka-ready na kayo. So yun, gagawin na namin ngayon. Start na namin kasi mamaya 1 to 2 hours lang yung pagitan kami na ulit. Yan lang.
Gurnix. Nagkagulo-gulo na tayo. Sa kanina sa HPI, jump. Dapat systematic tayo. Ngayon, in the PE, the patient comes in respiratory distress. Hinihika na. Pero, mas ang tatanungin niyo pa, yung hair ba niya, we are in the ER. ER tayo eh. Nasa ER na ba tayo? Hinihingal. Kayo, you take the place of the patient. If you are the patient, nahihirapan kang huminga. Tapos tatanungin sa'yo ng clerk, yung buhok mo ba? Paso yun? Ganyan. Parang dapat, huwag na mong tanungin na, focus sa organ involved. The patient is in respiratory distress. If you are in distress, what are the signs of respiratory distress? Dapat deflaring, and that was never asked. Kasi ang kayo, magtanong, teka huni, we have a patient kaya nga tayo nag-history taking it. Pero teka huni kayo magtanong, which is wrong. Ask questions pertinent to the case. So we will meet 11 to 12. Okay? That is start 2.
Ayun, tapos na yung search group na mag-history at physical exam. So kami na yung susunod, yung think group, which is mag-iisip na kami ng approach diagnosis, differential diagnosis, yung discussion ng case ng patient, which is acute asthma in exacerbation. Tapos, yung mga laboratories na kailangan i-request. Dito sa think part, magandang reference yung Nelson's, which is yung reference textbook sa pediatrics. Yung up-to-date, tsaka yung boss. Tara, gawa na tayo. Yun, tapos ko na yung part ko. Mamaya, 15 minutes before the presentation, ire-review ko na lang siya para naman makasagot kahit paano sa mga questions ni Doc about that. See you later! Bye!
Okay, start na. Good morning, everyone. Good morning, Doc. So right now we're going to have our think session. Next slide, please. So our patient is Marcos, a 16-year-old male who came into the ER due to difficulty of breathing or nahihirapan huminga 3 hours prior to consult. Percent of the predicted peak expiratory flow rate of the patient.
Good. That is what is important. Sige, proceed.
Yes, no. Okay.
Dapat nakasulat yun sa salient features eh.
Okay po.
Salient.
Sige po, we'll add it later po. So for the presenting manifestations, the patient has difficulty breathing, cough, nighttime awakening, wheezing, and also in respiratory distress. So for the approach
approach of diagnosis, we are looking for symptoms, sign, or laboratory finding pointing to an organ or part of an organ system.
So for the diagnostic test to be requested, so for the blood test, we can request for CBC with differential count. So no blood tests are available that can determine the presence or absence of asthma or gauge its severity. However, CBC with differential white blood cell analysis to screen for eosinophilia or significant anemia may be helpful in certain cases. So we typically obtain a CBC and differential count when asthma symptoms are severe, as for the case of our patient, and when the patient presents to the hospital with an exacerbation. Significant anemia can cause dyspnea also, that is unresponsive to asthma therapies and would require further evaluation to determine a causative process. So CBC is requested. Next one is the blood gas analysis, arterial blood gas. So for the blood gas analysis should be performed if O2 sat.
Excuse me ha.
Yes,
These are the diagnostic tests of the patient ha. For the patient ha. Hindi yung textbook na pag asthma ito.
Yes,
You
Father.
have a patient ha.
Yes,
So
Father.
why will you just tell us the indication. Why will you do ABG in our patient? Ganun lang.
For ABG, we do
We are in the ER. We are not in the classroom.
yes.
The way you recite, you are in the classroom. We are in the ER. We are not in the conference. We are in the ER. So tatanungin sa'yo ng residente, bakit gusto mo pa CBC? Ba't gusto mo pa ABG? Straight to the point.
So for ABG, doc, because our patient's O2 sat is lesser than 94, ABG is already indicated because patients with acute asthma exacerbations initially will have low PCO2 and respiratory alkalosis due to tachypnea. So we can monitor if there is a rise in PCO2.
What is the medical word for low PO2? You know, medical student ka,
Hypoxemia,
so you
doc.
should use medical words.
Hypoxemia, doc.
You use medical words.
Okay, doc. So
Why do you need to do a peak flow?
for the peak expiratory flow, this peak expiratory flow will tell us whether it's suggestive of asthma, doc.
So you're
Because,
not yet sure na hindi siya asthma? I think
sure.
you disagree, sabi niyo na nga.
Sure na po, doc.
Severe.
Since-
So why do you, if it is suggestive?
Since
So
nagawa
why
na po
will
yung...
you use a peak flow? Why will you request for a chest x-ray? Is it routine to do a chest x-ray?
For chest X-ray po, it is only indicated if it's severe, doc.
Yun, very good. So sa 1 o'clock, sabihin niyo sa akin, read the Nelson's textbook. That's Bible natin yan eh.
Okay po, doc.
Why the need for SARS-CoV-2 RT-PCR?
So for the SARS-CoV-2 RT-PCR, since we are in the since there is an outbreak, the patient is in the emergency department, and given the challenge of the COVID-19 outbreak po, this test is to segregate non-COVID-19 patients from suspected COVID-19 patients po for triaging.
Sa lahat na pupunta sa ER, na may ipapa SARS-CoV-2 RT-PCR. Okay?
Yes,
So anything more? I agree with all your diagnostic tests, but hindi mo na-rationalize why do you need to do this in our patient.
Okay po, doc.
Hindi nyo na-rationalize. So you have to read, okay?
Okay po, Doc.
So anyone, any questions? Any questions?
None po, Doktor.
Sige, we'll meet at 1 o'clock. Ha? For the
Yes po, Doktor.
Okay? O yung mga may utang dito na sagot ha, please answer it. This is learning ha. Sige. Bye-bye.
Goodbye po, Doktor.
Bye, doc.
Grabe. Yes.
Sprak! So, ayun. Answeran natin yung mga assignment natin. Tapos, yung mga di natin nasagutan kanina, sasagutan natin mamaya. So, let's search. Let's search more. Basa-basa din. Bye! See you later! Yay! Hi ulit! So, 12:58 na. Time for the next session. So, log in na tayo.
Rock climb po is typically heard during expiration po, while chorus runs are heard usually during inspiration naman.
Ako mali. Ano bang reference ninyo at mali yung sagot ninyo?
Sa internet na po ito.
Don't rely on the internet. Okay, sayang yung oras, ano? That will be the assignment. So, how are we going to manage, ha? We are in the ER, ha? We are not in the classroom, ha? So, stop discussing na mga hindi importante.
So, ayun. Done na tayo sa isang session. Sinabi yung isang consultant namin kanina na diretso na lang yung R. So, punta na tayo. Pasok na agad. Kasi 2 o'clock yun. Yun, last part na. Yay! So, done na. After this. At isa naman pong masalimuot at gisadong araw ang natapos natin. At yan, ang isang araw ng isang online medical clerk. Till next time, bye!